A year ago this weekend, we all had an eye on a rapidly spreading virus called COVID-19. But for the most part, we continued to go about our lives at restaurants and ball games and birthday parties. Within a matter of days, everything would change. The gravity of the crisis in America quickly set in over the course of a week that ended with President Trump declaring a national state of emergency. Sirens, masks, and social distance became our daily reality in a pandemic that is very much still with us 12 months later. In our Sunday Focus, Gabe Gutierrez looks back at a year that has reshaped the world and ahead to new signs that it may return to normal.
At first, it seemed far off, a mysterious illness on the other side of the world.
The CDC announcing immediate screenings for a new mystery virus from China.
But by January 21st, 2020, the CDC had confirmed the first coronavirus case in the U.S. in Washington state. The next few months would be a blur.
A dramatic surge in cases of that deadly mystery virus from China.
Do you think it's going to keep spreading?
I think that it is heading towards becoming a pandemic, yes.
21 passengers on a California cruise ship soon test positive, but it isn't until March 11th that the world seems to tilt on its axis.
This is the first pandemic caused.
In a dizzying few hours, the World Health Organization declares COVID-19 a pandemic. Tom Hanks has it. The NBA suspends its season. The far-off virus begins to hit home.
The earlier we can detect this virus, the better we can understand it.
On March 19th, California is the first state to issue a broad stay-at-home order. New York soon follows. Within days, the first reports of overwhelmed hospitals. There's a run on PPE. The stock market plummets. The predictions grow dire.
If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities.
You kind of take my breath away with that.
Breathtaking moments become all too familiar. Naval hospital ships on both coasts. Homage to healthcare workers each night. Across the country, an unprecedented shutdown. The calls to reopen begin almost immediately.
I hope we can do this by Easter.
Mask mandates and business restrictions turn political, and President Trump makes public health officials visibly uncomfortable with this outlandish suggestion.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light.
The virus ravages the Northeast, but explodes elsewhere by the summer.
The official statistic, Dr. Fauci, is that 80,000 Americans have died from the pandemic.
Most of us feel that the number of deaths are likely higher than that.
Then social justice protests collide with the pandemic. By August, stimulus talks stall.
Keep the schools closed!
And the debate over reopening schools intensifies. More of the COVID map turns red. In Texas, patients are airlifted from El Paso to other cities.
Over the last 10 days, we've seen this 300% increase. It's unprecedented.
In October, President Trump tests positive. He's whisked away to Walter Reed, and within days, a dramatic unmasking as he returns to the White House.
And now I'm better, and maybe I'm immune. I don't know.
The holidays bring warnings of potential super spreader events, but in December, new hope arrives.
This is a historic moment. The first trucks carrying the vaccine pulling out of the Pfizer plant, escorted by U.S. Marshals.
The Moderna and Johnson & Johnson vaccines are not far behind.
The lifeline for our country and our world.
You're exhausted?
Yeah. I'm tired of patients dying with their family members on the phone and not able to see them. Sorry. Yeah.
Now another breathtaking figure. More than 500,000 Americans gone. A year ago, who would have fathomed the loss or the resilience?
And Gabe joins me now live from Minneapolis. Gabe, good morning. You've been reporting from hospitals across the country over the last year, including the one where you're standing right now in Minneapolis. So how different are things there today than on your last visit, say, a few months back?
Well, Willie, here at Abbott Northwestern Hospital, there were about 80
COVID patients when we visited in November. Now that number is down to less than 25. Nationwide, the number of daily COVID cases has dropped by about 75% since early January, and there's certainly a lot more hope at many hospitals across the country. It's been a welcome change of pace. And for some of those healthcare workers, though, Willie, it's hard to believe that it's been 1 year since the pandemic started. In other ways, Willie, it's felt more like 5.
Yeah, we cannot thank them enough. We say this morning the same thing we said a year ago. Thank God for all those healthcare workers. Gabe Gutierrez in Minneapolis. Gabe, thanks so much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.